not on that.
Yeah, I mean, it sounds like she gave you an answer to a different question. Almost, right? Because your question is about maybe a specific skill or some sort of specific piece of development that you were wanting to know about. And she gave you the broad answer instead of kind of that system-specific answer. Here, say, hey, you're part of my care team now. I got this other question come up, and I kind of want to know what's happening with that specific skill. Did I see one of you?
What is a typical age to have a neuropsych eval for the first time? My daughter is 6.
Yeah. So most commonly for me, what ages is the first age to get one done? What's a common age? In our practice, we'll see kids 3 and up. We're not doing very much with like 3 and 4-year-olds because they like haven't learned very much stuff. But certainly 5 and up, golden. I do, and 6 is where we really start getting better data because then you've got a full kindergarten cohort, they're going to school, we have so much more rich data at that age, so 6 is a great age.
And then how often are they reevaluated?
Depends on what the neuropsychologist sees. So for some of my patients, if I know they're acutely doing a bunch of treatment changes, so say you're changing a bunch of medications, or it's pre to post surgery, or something like that is happening, I'll say, you know what? I want to see you again in a year because I know we're working on all of this stuff to address your seizures medically right now, and I'm gonna want to check that again in a year. For a lot of cases, I'll say every 2 or 3. But for kiddos, usually not too much more than that because there is so much just general child development happening. I want to check in with them every couple years and make sure they're set up in the school environment the way that they need.
Just like we talked about before in terms of his
Yeah, what if they had the seizures before the language started to begin? So he had it right before he was 2, and then he's going to be turning 4 in May. We're still starting to see some progress with the words, but not very
sometimes 2 days
much.
after surgery.
Yeah. So it's always going to depend where the seizures are coming from, and you know, are they generalized? Are they kind of localized and specific? Is it impacting that language area specifically more than any other area of the brain? But naturally, you're going to see some delays, right? Because it's just kind of interfering with the brain's normal and natural brain development. And so it's trying to forge all of these cool new pathways, and then you get these crappy seizures that come in and disrupt that development somehow. And it goes, well, wait, I was trying to build this cool new bridge from this to this, and learn that apple also gets tied to like red and fruit and chewy and crisp. And I disrupted that bridge, and now I've got to go back to building it again.
Yeah, he hasn't had one since, so that's why I was kind of like curious as to
Extratemporal, everything
something
outside
else
is about 50
going on.
So when we say that there's a seizure, it doesn't just have to be that seizures themselves are causing issue. There can be the underlying brain issue, or maybe it was an illness or something else was happening that caused the seizure. So we talk about seizures as being a symptom, right? They are. The seizure is a symptom of something else being dysfunctional in the brain, whether that's a cortical dysplasia, or a tuberous sclerosis, or a stroke, or just something grew in a little bit funky, right? And so it's not in a way that's firing the right way that it should. What the symptom is the seizure. So there could be just some underlying little abnormality or system. You might even not be able to see it on MRI. A lot of my patients will have normal MRI scans. But just to know that there might be a little bit of those delays, and to be doing the intensive speech and language therapies and things that you can be doing while they're young and kind of pushing forward as much as you can. And socialization, because socialization is always going to push that with kids. Making sure that social interaction, which really helps push and drive communication skills, helps you